Bhattacharya is now claiming that COVID saved lives in Sweden. Let me say that again. The head of the nation's premier life sciences institution is claiming that Sweden had fewer deaths during COVID than they would have had if the pandemic had never occurred. Let's look at the science to see how he got it so wrong and what that means. Bhattacharya was responding to a UK government report saying more aggressive public health response would have saved lives. He posted the graph to show us that Sweden proves the opposite. So let's look at the graph. At first glance, it seems to show Sweden with an increasing advantage over the UK in terms of excess mortality. But look again. The graph shows negative excess mortality in Sweden. So what is negative excess mortality? Excess mortality refers to the actual number of deaths minus the expected number of deaths. In this case, expected death refers to deaths that would have occurred if there had been no COVID pandemic. So excess mortality means there were fewer deaths than would have occurred with no COVID pandemic. Imagine it's the end of 2019 and your task is to predict mortality for the next 5 years. That is expected mortality. And the only thing you have to work with is past mortality. So here's Sweden's mortality from 2010 to 2019. You can never know the true value, and there are multiple ways to calculate the estimate. The simplest way to predict the future is to take an average from the past. An average works well if rates are stable. But these rates don't look very stable. The dotted line is the average, but there is a clear downward trend in actual mortality. It's just the solid line. If mortality has been changing over time, we can fit the line that reflects that change and project it forwards. These data appear to have a clear downward trend, so that seems like the better choice. Here's a graph of expected mortality, which is again the dotted line, and actual mortality, the solid line. Excess mortality is the solid line minus the dotted line, and when you do that, Sweden shows positive excess mortality during COVID. If we use the 10-year average to estimate expected mortality, excess mortality becomes negative throughout the pandemic. But that's so obviously wrong that it's not usable. So instead, Bhattacharya goes for a third option. He replaces the decade-long trend with an average of just 3 years. That's a bit like using your last 3 games to estimate your batting average. But it makes mortality, excess mortality, more credible. This shows positive excess mortality in 2020 and negative excess mortality for the rest of the pandemic. It looks slightly more credible, and that seems to be the story that Bhattacharya wants to tell. Meanwhile, mortality in the UK has been relatively stable with no downward trend, so an average makes sense for estimating expected mortality and produces a substantial excess mortality during the pandemic. And that's how you get this graph. Positive excess mortality in the UK and negative excess mortality in Sweden. The graph comes from a website called Mortality Watch. In fact, a version of that graph is its background image. The site is run by an anonymous software engineer known only as Ben. Not a virologist, not a data scientist, and definitely not an epidemiologist. In fact, Ben's blog is a masterclass in bad epidemiology, where he makes claims about things like a hidden death toll from vaccines, a pharma conspiracy behind the measles outbreaks, or that there was some sort of genomic fraud by a cabal of virologists. And Bhattacharya has been posting his graphs for a couple of years. There's one other critical issue about this graph. Note that Bhattacharya compares Sweden to the UK. Epidemiologists are very careful when comparing countries like this. There are many differences between them that could affect COVID rates, but have nothing to do with public health interventions. With respect to COVID risk, the UK and Sweden are very different. The UK has far more air traffic than Sweden, including more than 4 times the flights from China. And that means there were far more cases coming in early in the pandemic. The UK also has more than 10 times the population density, meaning the disease spread far more easily once it arrived. So this comparison is completely inappropriate. With those differences, we would expect Sweden to do much better than the UK. When we look at actual COVID mortality, it only does about 25% better. Bhattacharya never shows this graph from Oxford. He gives us an inappropriate comparison of inappropriate estimates from Ben's website. So why construct an analysis this misleading? Because Bhattacharya was a lead author of the Great Barrington Declaration, the argument for minimal intervention. Sweden was the closest real-world test of that idea, and if Sweden failed, the strategy failed, and he was wrong. He's not analyzing data, he's defending his legacy. And he does it on his personal account, which means everyone who has criticized him in the past is blocked. In other words, the head of health sciences in the US government is sharing manipulated mortality data in a space where scientific critique can't reach him. This is influencer behavior, posting optics for a curated audience, not the behavior of a scientific leader responsible for public trust. When the NIH director shares manipulated mortality data from an anti-vaccine blog built on a calculation that produces impossible results, that is not a scientific mistake. It is a breach of scientific integrity. It is unconscionable for someone in his position. The public deserves leadership that understands data, respects evidence, and protects public health, not someone still trying to win arguments from 2020. We deserve better. If you found this useful, subscribe, share, support us, and stay tuned as we cut through the noise to separate science fact from science fiction.